And I want to thank everyone who registered. We had over 250 registrations last I checked a few minutes ago, so we're probably higher than 250 at the moment. Thank you to everyone who provided questions for our speakers. They were excellent, and they really helped inform what we'll be talking about shortly, so thank you. And before I turn it over to our wonderful moderators, I just want to note their names. You can see our moderators are Kay and Zarina, and then who will be engaging in a really wonderful conversation with Esther and Anna, and all of you. There are a lot of you who are part of these media cafes that have joined today and can share your wisdom and experiences. We hope to hear all your questions and comments and have this be very conversational. There's very few slides, so this will be one of those webinars where more about discussion than looking at 8 million PowerPoint slides. So you're welcome in advance. I am gonna stop sharing my screen, and I am going to now invite our moderators to come to the stage, the virtual stage, and kick us off. Thank you so much.
Thanks, Jim, and thanks, DJ Manju. That was great music to start us off. I'm Kay. I work with AVAC, and I, along with my AVAC colleagues, Angelo, Bridget, and Manju, support the cafe program. And I am the one who's going to do just the very few slides that we have to get us kicked off, and then I'm going to turn it over to my co-moderator, Zarina, who's going to lead a fabulous conversation with Esther and Anna and all of you. So let me get the slides out of the way. Let me find my share screen. Okay. Don't need that one. So what is a Media Science Cafe? For those of you who don't know, they're vibrant journalist-led discussion spaces that bring together journalists with scientists, implementers, advocates, policymakers, and other experts to discuss timely issues around science and health. And they've been going for a decade, and they were originally conceived as HIV prevention focused at a time when there were a lot of HIV prevention trials reporting out results and new trials starting. And the idea was to build journalist knowledge of HIV science and the research process to help journalists prepare for trial results, to build trust, really importantly, to build trust between researchers and journalists, to bring advocates' voices into stories, and to just improve the overall quality of HIV prevention coverage. And over a decade, I think we can say that we have done that quite well. And in 2020, as we all know, the world as we knew it changed. But the opportunity in the COVID pandemic for the Media Cafe program was the ability to expand to include COVID science and policy. And as the years went on, vaccine confidence, pandemic preparedness, and the nexus of climate change and health. And the cafe journalists were really well placed to take on these new important health stories because they understood science. They know the science jargon and lingo. They know the researchers and the implementers who straddled the HIV and COVID spaces. And so they were really some of the best prepared to report on COVID. You can learn more about Media Science Cafes on avac.org, and there's a Rockefeller Foundation case study that is a really lovely profile of the program. And you can also reach out to us at media@avac.org. This is just a quick round of pictures of the conveners and cafes in action. And here are where the cafes are. The original cafe, what we call the mothership, was started in Uganda, the Health Journalist Network of Uganda, and they literally held their cafes under a tree. So that's where we get the tree icon from. Uganda was joined over the last decade by Zambia, Zimbabwe, Kenya, and in the last year, Malawi and Tanzania have joined us as well. So now we have 6 cafes in East and Southern Africa. And why does AVAC support the Media Science Cafe program? We realized that outreach to and sustained relationships with journalists can help further amplify and journalists that can help further amplify scientific information is really key to helping journalists understand and explain complicated science. And we've seen the evidence. It leads to better and more nuanced coverage of even the most complicated science stories. And AVAC's funders agree with us and have invested in this program over the past decade to help ensure ongoing sustained support for accurate, nuanced science and health reporting. The Bill and Melinda Gates Foundation and USAID were the original funders who supported the HIV prevention cafes, and they were joined during the pandemic by the Rockefeller Foundation, which allowed us to expand the program to include Malawi and Tanzania, and the Sabin Vaccine Institute, which has helped us also focus on vaccine confidence and COVID and vaccines. How do the programs work? They're localized to each country. Each country is different, and you'll hear more about that from our panel. But generally, it's monthly or so cafes with expert speakers, researchers, and policymakers, and always representatives from civil society. Civil society brings their own expertise in an informal setting. In Uganda, literally under the tree. In other places, it may not be under a tree, but an informal setting where everyone's sitting around the table or sitting under the tree are equal in their discussions. So the topics have included HIV prevention research, COVID vaccines, cholera outbreaks, which we've seen in many of the CAFE countries over the last year, expanding to pandemic preparedness and more. Cross-border cafes, one of the silver linings of the pandemic, when everybody had to go in and cafes couldn't meet in person, we moved to Zoom, and we realized that if we're in Zoom, there are no borders. So we started the cross-border cafes. It's an opportunity for collaboration, to bring experts from other countries, from the CAFE countries and beyond, to cover topics and bring journalists a perspective from outside of their country. The bottom line is the CAFE programs support a cadre of science journalists who come month after month. These aren't trainings where you bring in a group of 20 journalists one month and a different group of 20 journalists in the next month. People come month after month, year after year, and improve their reporting over time and develop good relationships with the experts. One of the innovations that we've seen over the past few years are regional cafes that support journalists out of the major cities and are often done in local languages. More and more, the cafes are working on ensuring that people who are living outside of the capital get information, high quality information about science in the language that they speak in their daily lives. The conveners support journalists through mentoring, vibrant WhatsApp groups that provide information. They check misinformation and provide links to experts. Advocates and researchers have come to trust journalists through building real relationships. If there's one thing that underpins all of the work of the cafe, it's really building those relationships. And editors' engagements build support for the cafes in the media houses and facilitates better reporting. And AVAC and our partner Internews, which is part of the Casper Coalition, work with AVAC to support cafes through mentorship, training, and ongoing information sharing. Our Internews colleagues, Chacha Mwita and Ida Yusta, are key members of the Media Cafe family, and both of them are journalists who really bring that journalist mentorship into the program. The AVAC team provides context and capacity building and strategy. We help track the field and help the conveners, and through them the other journalists, make sense of the science and what's newsworthy, and keep conveners updated on what's happening in the field. And we also link journalists to global experts and to the AVAC partner network. We provide regional trainings, usually once a year, to focus on deep dives into science and policy. And our latest innovation, thanks to support from the Sabin Vaccine Institute, is a translation index, which is 100 HIV, COVID, vaccine, and health terms in 10 languages from East and Southern Africa. And we'll drop a link to that in the chat. And please do go and check that out. We think it's a great resource. So that's the overview of the cafes. We got so many great questions as people registered. And so we picked a few to start us off. By far the most questions asked, how can researchers be engaged with, I love this one, how can researchers be engaged proactively to appreciate the beauty of translating their research products into news stories? That building that relationship was a big question for people. And I am going to turn it over to my colleague Zarina to get us kicked off into the discussion.
Hello, everybody, and thanks, Kay, for that very exhaustive introduction. My name is Zarina Gelu. I'm here in Lusaka. I'm the convener of the Media Science Café in Lusaka, MESICA we call it. And yeah, happy to be with you all. And you're going to spend a great hour with our panelists. First up is Anna Miti. Anna is from Harare, Zimbabwe. She's a journalist, blogger, an HIV advocate. She's a former AVAC advocacy fellow and an IAS Cure Research Advocacy Fellow. That's huge. She works with the Humanitarian Information Facilitation Center, which convenes media science cafes and also has health reporting training. She's the current chairperson of the Health Communicators Forum in Zimbabwe and is passionate about HIV prevention advocacy among adolescent girls and young women and community engagement about HIV care and treatment. That's the full package. Then up we have another accomplished journalist, Esther Nakazi. Esther is from Uganda. She's a health and science reporter based in Kampala and the founder of the Health Journalists Network in Uganda. And you remember Kay mentioned that this is the mothership. She's the one that started the Media Science Cafes. So Esther is also a media trainer and mentors journalists in science reporting. She was a mentor in training in the Mentoring for Science Journalism project for the World Federation of Science Journalists and contributes to media outlets around the world, including writing for The Lancet. That's huge. She won a Knight Science Journalism Fellowship to spend a year at Harvard and MIT in Cambridge, and was a journalist in residence at the Institute of Tropical Medicine in Antwerp. She's also a 2020 Chevenings Africa Media Freedom Fellowship Fellow. That is awesome. So these are your two panelists today, and I'm sure we're going to have a very engaging discussion. Just a reminder that if you put your questions and comments in the chat, and if you want to contribute, just raise your hand. So I'll turn it over to Esther. And maybe, Esther, we can start with one of the few questions that we picked out that was sent in from some of the participants. So one would like to know, how should media engagement be conducted in a meaningful way? And to follow on, what's the difference between media engagement and PR?
Wow, thank you
and
very
of course,
much.
Anna, you can chime in as well.
Thank you very much, and thank you everyone for coming for this webinar. I hope you can hear me loud and clear. I've lost power in my home, but I have some sort of backup. So the difference between PR and meaningful media engagement is, I think, is very much known to most of us. PR is very one-sided. It's very glamorous. It's very it's just not what would be done in a professional way. It's professional in one sense, but it's not sustainable. And media engagement in using science cafes is very, very sustainable, because we do this every month. We do this in a diverse way. We use languages. So media engagement is a different ball game from PR. PR is very one-sided, I must say. Yeah.
Thanks, Esther. Anna, would you like to chime in?
Sorry, I was muted for a little bit there. So thank you for that. And thank you, Zarina, for the beautiful introduction. I was feeling like, those guest pastors at the church, and then, they're saying this is a man of God and whatnot. And now you really don't know how to smile because they're saying all these wonderful things about you. But Esther has said quite a lot today in terms of media engagement. But I want to speak to the model that is the Media Science Cafes, whereby we always have three pillars in terms of speakers. You have the researchers, you also have an advocate or someone from civil society, and if it's it's relevant, we also have someone from the community who is affected probably by the topics that we are discussing. For example, if we are talking about ring or the debriefing ring research, we can bring someone who was part of that research. We've done it before as a participant. We've also had researchers. We've also had advocates. We also believe deeply in the Media Science Cafes that when we are talking about experts, we're not just talking about those people who've got big titles, people who've got, those, big jobs, because I am an expert in my life. If you are asking about women of a certain age, I'm an expert in that community. So we always want to relate that to the people that are affected by some of the things that we talk about. So in that case, it differs from your PR, because PR usually they just bring in someone who's giving you this breaking news story of something good that they have done. But with the Media Science Cafe program, we are saying, let's have different perspectives from different people. And one thing that I love about the Media Science Cafe, this part about bringing in different experts, normally in some of these big conferences that happen, which we love, we know that that woman, I'll give you an example from Zimbabwe, the woman from Zarabani who's fighting cholera, is not able to go to a big conference in Harare to attend something, or even go to the IAS and talk about their experiences with cholera. But with the Media Science Cafes, we've managed to bring in community workers who have worked with those people at the very least. So it gives those people a platform also to discuss things that affect them in their daily lives. And that for me is something that's actually quite great, that has worked well for us, because what it then does in the media is that your story it's got a human feel to it. It's got a face to it. It ceases to be just about numbers. It ceases being about concepts, abstract science concepts like, maybe, I don't know, biomedical HIV prevention, but it becomes about real people with real lives that get affected by these things and the things that we should be talking about. Over.
Thank you both. I have a very interesting comment from Jeanne Barron here. She says the goals are very different with PR. Media engagement pursues accuracy and understanding of nuance, not to be distracted by the easy sensational story, which is very true. And many times, like what Esther was saying, that PR is about, being nice and cozy and, beautiful things. But the real life is that it's not. And it brings me actually to something that a question that was asked about research. How do we get the media to be interested in research when it's not trending, when it's not good for PR? It doesn't have any sensation. It's just good, solid information. How do we get media to be interested? And then also, in the same vein, how can researchers be engaged proactively to want to have their research translated into news stories so that, people get the information that they need?
I'll go first, then Anna. Thank you very much, Zarina, and thank you very much to the audience for these questions. So I think over the time when I've worked with scientists and researchers, They very much do not know how the media works. And they for a time in our engagements did not want to engage with the media per se. They were comfortable in their zone, publishing in scientific journals, and not interested in really working with us, with the media. So over time, we have seen that with science cafes, scientists have started and have progressively been interested in understanding how the media works and what is in it for them. Most cases, you know, everything to do with policy is relegated to government. And like Anna explained, when we do the concept of science cafes, we are really looking at having a government representative. We are looking at having a scientist or a researcher. We are having community speaking. We are having users who are usually expert patients or advocates who speak to what the community, to what they feel. If it is HIV, they're talking about what they feel. So bringing these people together, and the researcher is there. And researchers usually are you know, doing research on pretty much these people, helps them understand and put out information to the community so that it is appreciated. So in a way, the way we want researchers to get into this and proactively participate in it is for them to appreciate what the news brings to them. One, we want them to police. They are not policy makers, but we want them to police policy, because government is here, it's going to do policy, and you're there, you're a researcher, you're basically doing research so that it is translated to policy. So one of the things we want you there in the science cafes as a researcher is for you to understand that, well, I am here, but I'm also speaking to policy. And even if I am not acting, I am policing it and I am influencing it. I'm talking to journalists. And when journalists are in these media cafes, they are also putting out the information that has come from you as a researcher, and you owe it to the community as a researcher. Most of the funding that is used for research and for science are public funds. So researchers have a duty to put out information and let the community understand and appreciate. But also it's a matter of saving lives. When we do health reporting, when we do science reporting, when we do science cafes, when communities hear this information, for instance, when we do PrEP cafes where we know that there is, you know, Truvada is available, it's being translated into policy. It is in the shops. We are saving lives. We are saving one more life to understand that there's this drug that can be taken, and research has been done in these countries, in our own countries, and journalists are writing this. So the scientists, I think, have that to pick from these cafes and to talk to the media. And in that way, I think they do benefit. The other thing in terms of, you know, if something is not really trending, I think it's trending. It's sustainable. It's there. You have to learn. You have, like we've just explained, we've learned a lot over time. It's not trending at the moment, but then you learn certain things. You learn how terminologies are used, what new issues are happening. And when something new breaks up like COVID-19, which nobody knew, I mean, we had the ability to understand that we can use this information, vaccines work this way, because we had done that in science media cafes, and we had the knowledge. So I think it may be for the journalists, it's not trending news, but you're learning something. And I also speak to, in our media science cafes, we have a lot of community radios, community and local community radios which speak local languages. And the way we design them is that after we speak in the English, or after we speak in the language the scientist wants to communicate to us, we also urge them to simplify and speak the local language. When they speak the local language, they are in touch with the bigger community, because most of these community radios broadcast in the local languages. So it makes sense that it may not be trending at that point in time, but they are communicating something that resonates with the community in their own language, and people can understand what is going on. So not breaking news sometimes, but there's something to pick, something to save a life, something to know that this is happening and appreciate by the community and for us journalists. Over to you.
Wonderful
Thanks,
words. Thank you so much,
Esther,
Esther.
for that. So Esther raised quite an important issue here. She said researchers use taxpayers' money to conduct their research. So there's a certain obligation that they have to the communities to make this research available. So how do we get, Anna, how do we get researchers to understand that it's not just about their work, but there's also a moral commitment there, an ethical commitment to share their research with the public who finances their work?
Yeah, thank you for that, Zarina. So I'm going to give an example of a webinar. I think it was also a TCA webinar that I attended on PrEP-VAC. And one of the, so for those who aren't familiar with the PrEP-VAC research going on about trying to find a vaccine for HIV, it was stopped, but we did learn a lot of things from it. It didn't give quite the desired results. But one of the things that was talked about was an example of a social harm that came to a participant who was part of that study. And apparently this woman, you know, when you were in that study, they would tell you that you needed a specific HIV test, because if you take our usual HIV test, you will test positive, even though you may be negative. This is because of the antibodies that have been produced and a whole lot of science that is behind that. So this lady, you know, for some reason, she decided to get tested with her partner. I think they were a new partner. And then turns out that both of them, you know, were positive. And this gentleman, the male partner, beat up this woman because he was saying, you gave me HIV. And she was trying to explain, no, I mean, this study and whatnot and what have you. But, you know, there was domestic violence that happened. After repeated tests, of course, turned out that this lady who was in the study was actually negative, but the gentleman was actually positive. And you know, it's a social harm that comes because people know about a study, or they may know there's a study going on, but they don't know the nitty-gritties of this study. And it actually does affect the outcomes of such studies, because people can spread rumors, you know, whilst the study is still going on. People can spread rumors in the community. But if you involve journalists who may break the story about this study and follow up on the study every now and then with a couple of, it doesn't have to be breaking news, but just stories to say there is this study ongoing. These are some of the concerns. This is what the researchers are saying. It may actually have an impact on your study as a scientist. So I think that besides the whole moral argument that we are having here, that if it's public funds, but we're also saying that even as a researcher, if you don't have the right information going out, journalists can actually, we're not threatening researchers, by the way, but we are saying that we have had this experience before, where journalists would write stories from not because they want to be malicious, but because of the lack of understanding. Let's be honest, research is something that is it's very complicated for a lot of us who are non-clinicians. So you really need to invest in making sure that these journalists have the right information at the right time. And it actually does have an effect on the research. So this is how we urge the journalists. I wanted to speak also to, when you were talking about how do you keep the journalists interested, I always say to the journalists in our network, what's so different about you? This is how we actually had a cohort of journalists who were just, you know, reporting on HIV cure research, because there was a time when I was an IAS fellow and we were just doing HIV cure advocacy, and we had a cohort of journalists who would come for a cafe specifically on HIV cure, and you could see the interest. The interest is there, but you need to motivate the journalists to say, look, you want something that is unique to you, you want something that is different, you want a niche, you want to be published in the Lancet like Esther. It's not going to happen just because you wake up one day and you're like, let me write a science story. You invest in it, you keep researching, you give your resources and time. You may not see the results there and there, but it is worth pursuing. And I know that there are a lot of journalists that are on this call, and I will say that same encouragement to them. It may be complicated at first, but the more you get into it, the more you realize that there's a niche that is in this thing called science research and health reporting. More than just reporting, that the Minister of Health has said, so-and-so government official has said, your story can be different if you invest more into making sure that your story is different. Over.
Thanks, Anna. So I'm hearing quite a number of things from you. So could you, either one of you, tell us like personal experience that you've had where you've had reluctant researchers who have since shifted, realize that journalists are their friends? Because I think the more you have the cafes, I'm sure that the researchers realize that you're not poisonous at all. So do you have any personal experiences that you could share with us?
Yeah, we have many experiences to share, and I remember when we started the cafes, I kept on complaining and saying there's just a few researchers. There are just a few who are interested in coming for these cafes and explaining these things, because, as you know, a scientist's or a researcher's nightmare is to be misquoted. And all the time they would say, no, I don't want to do that. I don't know. How do I control that space? So I think over time we have had a number of scientists coming and researchers interested in coming to the cafes, because for one, we are an organized group. And it's not only us. I mean, everybody who does cafes knows that in their particular country, this is an organized group. These are people who sort of understand the science, and if the scientist comes and speaks, then they are sure that they will not be misquoted, which is something that they really fear. And over time, we have had quite a sizable number of people coming to talk to us, scientists, government officials. The list gets longer and longer, bigger and bigger, and we pride in that. And it takes away the fear. It takes away, if one talks to the other and says, no, there's this journalist group which is good, and they will not misquote you. And we also have a mechanism, because we are very organized. If our sources, because we do share, immediately after the cafe, you will hear a media echo. Everybody will go out and publish a story, because some media houses, some editors will send their reporters to come, and they have to account for their time. But besides that, the scientists themselves will listen to these stories and hear that, oh, if there's something wrong, we have a mechanism of saying, no, this is wrong. Can you please, we are a team, we work together, we know each other. I'll call somebody and say, I think you did not understand this particular issue very well. So over time, I think the scientists have learned to trust us. They have learned to know that if they work with us, there's a little bit, there's not much misquoting that is going to happen to them. And it's a friendship, but a balanced friendship. We do not keep them so friendly, because we have to balance our stories, and we have to report ethically. So we keep the ethics up there, and we try to lower them. But over time, we have had quite a sizable number coming to our cafes, and so does government, and so does community patient experts and advocates. Over to you.
Yeah.
Thank you, Esther. Anna, I'm sure you have an experience to share.
Yeah, I was about to do that because ours does not have a romantic beginning, but it does have a romantic ending. So our star, we like to call it our star, Dr. Nyara Zomgodi, who's been the PI in a lot of the groundbreaking researches that have happened, including in Zimbabwe, including for the ring. So at one time when, one of the first studies of the of microbicides was happening in Zimbabwe, there was it wasn't successful. So there were quite a lot of number of women who got infected with HIV. So the story that came out of that study, they were just explaining that, there were women who were in the study, they got infected with HIV. So there's really no difference between the product and placebo. And so, the usual. And then the story was these women were being infected by HIV in the study. And you can understand how heartbroken she was. She likes to tell the story. She says, even her uncles were calling her to say, we know you, we grew up with you, how we raised you. How could you infect women, with HIV? And it really hurt her. But then, the thing is, in order for recourse to happen, she had to, of course, reach out to people. And, lucky enough, we were part of the people who really went out to try and change that story and really give the right story. And then that's when we persuaded it to say some of these things are happening because people don't understand. They are not malicious. We even we had an intervention with the journalist who had written the story and her to say, look, this is not necessarily a thing that's happening because someone is being malicious. It's a lack of understanding. And from there, that's, how we came to invite her more and more to our cafes, reluctantly at first, but eventually. And just as recent as, just this past December at ICASA, she was calling me to say, oh, we've got something new that's coming up. You are the first who needs to know. So that's how you cultivate. Like we're coming from a person who was so heartbroken. And she was like, I would never want to see a journalist in my life, to actually inviting us to her space. And, she's the one person I hear that in meetings, she's the one person who says, don't forget to engage the media. Don't forget to call these guys from the Health Communicators Forum. Don't forget to call HIFIC. Like they know these things now. And I think the important thing is for that relationship to happen, for that trust to happen with the journalists. I do understand that, like I'm saying, we're not clinicians. So sometimes mistakes can happen, mistakes in understanding, mistakes in writing, and it comes out differently. Sometimes it's just about terminology. I know researchers don't like it when you say HIV, someone has been cured of HIV. They'll tell you about, no, it's remission because you're not really sure and because of, it's language. But as a journalist, might not have enough, room for a headline that says a patient in Berlin is in remission and whatnot and whatnot. And, you want to just say HIV cure, which I understand, sometimes even if I can be on the other side. So there's that need to cultivate that trust. But importantly, there should be recourse. Like if something happens that we're not happy about from either side, let us talk about it. Let us come to an understanding and an agreement. If it means retraction, I think it's good to retract if you know that what you've said is not what happened. So we need to cultivate that trust. That's what I would say.
Thank you. And Brenda Kakai, I hope that answers your question. You asked about how to correct it when researchers are being misquoted, because it's a lot of work for the researchers to correct in misinformation when it's already published. Yes, I think we all agreed that that is a problem. And, I think what Anna explained was that dialogue helps a lot. I see Mia is on the line, and Mia, you have something to say about the media and PR. I'm going to put you on the spot and ask you to unmute.
Hi, Zarina. Yes, I'm here.
Hi.
Hi.
Hi. I said I'm going to put you on the spot. You were talking about the mutual.
Yes. So
between
during
researchers and journalists.
Yes, so I'm based in Johannesburg here in South Africa at the biggest CISA Center for Health Journalism. And during COVID, we interacted with scientists much more than usually because the stories were obviously more frequent. And something on a more longer term benefit that happened there was, I felt like COVID almost like flattened the field a little bit, where scientists realized they needed knowledge from journalists as much as we needed knowledge from them. And the knowledge they needed from journalists was media skills. And we, were in contact with them 5, 6 times with the same person, often per day. And what that has resulted in now is that they then started to ask us to train them in how to do interviews, how to write op-eds. The donor organization even asked us to train them on how to use easier language. So that relationship has become mutually beneficial. It's become a form of income generation for us. But in the process, the relationships that we have with the scientists became even closer. So when we now in return can someone who we trained, we can, call them late at night and ask them just to explain something, or if we need a late night comment, because there's a more of an equal relationship now. It's not the scientist is up there and the journalist is down here. It's sort of like we share a skill as well, and we realize what they can give us, but it's more on a level where we know we can both give each other something without that burden of a scientist, because we train them, without that burden of them thinking, okay, well, because you've trained them, I can ask favors, I can ask you to cover a story when it's not a story. There's a very good understanding of what the kind of relationship should be like. So having something as intense as a pandemic really helped us to develop a relationship from something that wasn't very equal, where you almost felt scared of the scientist, to something where, it's more of someone who you feel that you can talk like just another person to, as opposed to being scared of the scientist.
Thanks, Mia. So yes, I like the point that she makes about knowledge and training, and as a way of the two-way communication between researchers and journalists. What I'm hearing also a lot is about trust, the trust between the journalists, the public, and the researchers. So over to you, Esther. How do you build this public trust? How have you built this public trust between your audience, which is the journalists, the researchers, and yourselves?
I think I've spoken to this a little bit earlier. In terms of public trust, we know that science comes in with evidence-based information, and we have journalists pick up this evidence-based information. And in a way, we know that the public really, really trusts scientists. For all the studies that I've seen, we know that the public does trust scientists. I mean, as opposed to politicians. We had, during the COVID-19 pandemic, we had politicians putting out messages in our different countries, particularly here in Uganda. We had the president coming on TV every now and then to relay information. And I must say that I think the public loved hearing the scientists speak, and because the trust is there. But also trust can be built when people understand what you're saying. So the media cafes have provided a platform where scientists know how to communicate this evidence-based information that they have researched for a long time, and it's in their hands, and they know how to make it easy. We provide a platform where it's easy for them to communicate it easily in different languages. Like I said, we try as much as possible to tell them, if you're coming to speak to the cafes, we do not want slides. We want you to speak to the local language too. And we want you to make these journalists who are carrying these messages understand, because one, they represent the community, but also they are also speaking to the community, which should be able to understand what you're saying. So cut down the terminologies, be as transparent as possible, make it very easy for the lay person to know what you're saying. And I think that in the long run does build trust. But also, you know, the frequency of engagement builds trust, and evidence-based information really wins. And that's what we do with the science cafes. Over to you.
Thanks. Anna, do you have something to share, personal experience?
Not quite, but just to echo what everyone is saying, and shout out to you, Maya. It's like yeah, that relationship has to be really cultivated. It has to be something that it doesn't happen overnight. That's all I can say. And sometimes it's not so much that the researchers don't want with the information. Besides having been burnt before, it's if it's something that is you know, you can't just share, you know, you can't just, research is a long process. Before you know the results, you can't say anything. You're really trying to keep you to your ethics. You're really trying to not influence anything one way or the other, because you're also supposed to be really objective and not looking at the product working one way or the other. So we also have to understand the researchers. So we try to be very patient, and we try to be really, you know, making it's a long call. Yeah.
Yeah, it is. And it looks like it's a very interesting concept here about misinformation, and correcting misquoting can be very frustrating. Emma Black Kamara, would you like to unmute yourself? Okay, I don't think she's. Yeah, I think the whole issue of misinformation and disinformation, I think we've touched on it. Oh, sorry, Emma. Do you want to unmute yourself?
Yeah, I've unmuted myself. Good afternoon, everyone, from my side. Are you getting me?
Afternoon.
Yeah, good afternoon.
Yes, we can hear you.
Yeah, like the issue of misinformation and disinformation in the area of health reporting and researchers, I think it's everywhere in West Africa, to be specific, because the researchers always look down on the journalists in the ground that we will not understand them in a very clear terms. So even in Sierra Leone, most times the researchers don't want to have anything to do with journalists. And if they refuse to talk to us, they left the journalists with no option to write whatever they understand. So in that regard, sometimes the journalists may misquote the medical terms or the research concepts. That will infuriate the researcher more. That's what I experienced in Sierra Leone. Most of the senior doctors here don't want to talk to journalists because they believe that the journalists don't have the capacity to report on health-related issue or scientific-related issue. So most of the researchers have this kind of doubt. But like with this scientific cafe, it's good for us to brings researchers on board, for them to trust us and help to educate us, so we'll be able to disseminate the information in a very clear terms. Because the public rely on us to inform them. If they keep the information, we don't know how to get it. So at the end of the day, the public will not understand what this researcher is doing. For example, in Sierra Leone, before the COVID-19 in 2014, Some people and some researchers were at the Gola Forest between Liberia, Sierra Leone, and Guinea. They were there like for someone doing research. After they gave an order to the tribal heads to inform the people that no one should enter the Gola rainforest. This paramount chief just explained the thing casually because they don't understand the effects of that. In a result of that, we have COVID, Ebola 2014-2015, which claimed the life of many Sierra Leoneans. It's because the information did not reach the appropriate people like the journalists. They only talk to the paramount chief and the tribal heads. They thought by informing the people in the community, the message would digest. At the end of the day, other people from various communities went and catch animal, go and prepare it for food. So at the end of the day, the Ebola came. That's why we are saying the
Well, we seem to have lost you there, Emma. But thank you, we get your point. Jubiel, Jubiel, would you like to unmute yourself?
Yeah, sure. My name is Jubiel Zulu from Zambia. I just wanted to find out from you as panelists, I don't know which one will be able to take it up, but looking at the fact that when a disease strikes, maybe let's say in the case of Zambia, where we're finding a lot of casualties when it comes to cholera, the cholera that maybe some good 11 years, we actually ensured that people were safe. It has now come back with full force and a lot of people are dying. Are we doing enough, or is it that maybe there's something that we are not following rightly in terms of research and also just the way scientific trends are moving in order to ensure that our people are safeguarded and they are safe despite these occurring diseases, including cholera? You might talk about chronic illnesses that can be formed because of COVID-19. I'm pretty sure that when it comes back, it's going to be very hard for us to actually just ensure that it goes down without many people dying. Thank you.
So I guess you're talking about what is the media doing enough to advocate and sensitize on cholera? Yeah, I think Anna from Zimbabwe, we seem to have the same problem.
Yeah,
Cholera.
maybe I can speak to so Zimbabwe. We have had quite an experience with cholera. Very sad, of course. In 2008, that's when we had one of the major one, the first major one, where almost 5,000 people died. And then we had the second one, which was in 2018, 2019, thereabouts. And then now we are also going through another cholera epidemic. So I'll speak to in terms of, is the media doing enough? The difference, and I see this, I think it's something that I share a lot. The difference between the numbers that we are seeing now and the numbers that we had seen in 2008. By the way, cholera is a structural issue. It's more than just people washing their hands. It's people having access to clean water in the first place. It's people having access to ablution facilities in the first place. And this is something that's structural, is something that's, it's been talked about quite a lot. It's not, it's not something that it can be fixed overnight, but I think it's governments that really need to be doing this. So the difference that I see between the cholera epidemic of the pandemic that we had in 2008 and the one that we are having now is the issue of the media. In 2008, it was not in the media. It was like very closed. It was like the government then did not want to disclose that we are having such a huge issue. And it really went big. There was a bit of denialism in there that I will speak to say, we really were not open about the fact that we had so many cholera cases until it got to that extent. It got to that extent where, you know, people were, because they were not doing the right precautions, like having the government bury people who have died of cholera. People were doing funerals because it was like almost a situation, it was normal until it got to a point where there were too many cases to handle. And that's when it became open in the media and all that. But as soon as in 2018, as soon as the first cases were there, it was like there in the open, and already there were public campaigns. It was all over in the media. People were talking about cholera, and that's what happened. I think this is one of the things that saved us. It's not the only thing, of course, but I think the quick response was because it was there in the public, which is the difference between 2008 and 2018, at least in Zimbabwe. So for now, I wouldn't say that the media is not doing enough. We do cover, but cholera is complicated. It's a whole other issue. It's our cultures. Like, people don't want to not go to funerals. You're told I actually have a relative who passed away from COVID, and I'm telling you, people were at the funeral. It was in the rural areas. Like, people were at the funeral, and you're like, but don't you understand? But then there are rituals and things that we need to be doing as Africans during funerals. Like, we need to do the body viewing. They want to wash their own relatives' deceased body. They don't want the mortuary attendants to do it. It's cultural. And so cholera is very complicated, but we need to keep it in the media. There's also religious beliefs. I think there was a story that came out in Zimbabwe that, you know, one of our journalists wrote that beautiful story about how religion also plays into it. There are people who are just religious objectors. They do not believe in any form of medication. They think the salt and sugar solution is enough, but in cholera, it's not really. You will need some, you know, some other intervention. And, you know, people have this myth, no, just take, you know, salt and sugar solution, you'll be fine. You don't need to go to the clinic. So there's a lot of things that are happening with cholera. I'm sure Zambia and Zimbabwe are said to be Siamese twins. I know there's a lot of things that happen in Zambian communities that also happen in Zimbabwean communities, but I feel like part of it is that what I'm talking about. It's structure. It's beyond just writing about it. There's a lot, but we do need to keep the story in the media. An interesting thing also is the issue of translations. Speaking about health in simple languages that people understand, I think most interesting COVID stories, cholera stories that I've come across are actually in Shona and Ndebele, which is our local languages. And you can really feel that this person, it's understandable. It's more than just someone telling you the scientific name of the cholera bacteria that I can never pronounce, Vibrio cholerae, something like that. But it's beyond that, it's something that's relatable to people. So I believe we can do more, but we also, an important story is not just telling people to wash their hands, it's holding governments accountable. Because why are we washing hands with dirty water? I'm going to stop there. Thank you.
Thank you, Anna. Sorry, Esther,
I
you want to say something? Yeah.
A little bit, yeah. Thank you, Zulu, for the question. And like Anna has said, I think it's about giving accurate information sustainably, continuously, so that people hear these messages. We do have a lot of taboos, beliefs in Africa that we hold on to during these pandemics, and we keep them even if we have evidence-based information that says you shouldn't do this or do that, but people keep holding on to them. But also I wanted to bring in the perspective of the bigger global, community. We know that vaccines, cholera is vaccine preventable, and vaccines are somewhere. Similar thing to COVID. We need to speak up more as African journalists, advocate more and say, yeah, there may be structural problems in our countries. We need health system strengthening, but we also need justice to access these things. We cannot just sit there and say so many people are dying. We cannot access cholera vaccines. I mean, the cholera vaccines are available. They can be given to these people, to us as Africans, and the disease can stop. We know that vaccines are the single most important thing that can stop something. So I think we need to sort of up our game in terms of advocating for access to some of these things, and not just, we love the messages, we can sustainably give it to the people, but we also need to put out our voices in a loud way so that the global community hears us, so that we have access to some of these issues. Thank you.
Yeah, great. Joyce, just before, and Catherine, just before I get to you, you've talked a lot about public health and, the public itself. And I know that the cafes also are quite big on civil society representation. Can you tell us a little bit about how these have lent to the discussion, how these lend to also looking at alternative views and being the voice of communities in the cafes? After that, I'll get to Catherine and Joyce. Briefly, Anna.
Right. So in Zim, we have like for the urban areas, we usually have what are called residents associations, and these are like pressure groups that can really speak. So when I was talking about, for example, holding governments accountable, it's not easy for you as a journalist to have, actually it's not an op-ed, so your opinion doesn't really count. But if you get the voices of such people, and we've had them in our cafes as those pressure groups, an example would be the Harare Residents Trust. And they really came out in a big way talking about these things of how there are some new urban developments that have been in existence for the last 20 years and they don't have piped water and they're in urban area, for example. And these are people who can raise such issues, and it's been really great to have them. And then, of course, we've also had the patients. I think Esther spoke about expert patients, people who have survived cholera, really talking about their experiences. And it really does also bring out the human side of this story, because people, when you are reading about cholera in a newspaper, you never think it will affect you because you're like, I wash my hands. But it's more than just that. This is why it's important to have people who have survived who tell you, I did this, I did that, this is what happened to me. And, and they really bring how serious this issue really is. So yeah, we've had really good experiences with bringing in other voices from the communities. Yeah.
Thanks, Anna. Esther?
I think Anna has pretty much said it all. I mean, when the design of the cafes is really to have advocates on the table. Advocates bring in a perspective of, what they see in the community, what they stand for, what they want to push for the government to change, and they usually give us that perspective of really holding governments accountable. I mean, if all even global players accountable to things that should be done right. So the advocates' voices are very important. We journalists also, some of us play, some journalists play that role. You want something to change, and you're out there and saying, but this should be done right. Why are we not, we waste the money for this, and why are we not getting that right? So advocacy is a big thing, and we have advocates on our science cafes. They usually come in with a lot of information. They usually push government to do right. They usually will speak to power and let them understand that this should be done, and they balance our stories really. And like Anna said, we do also use the patient advocates, because if, for crying out loud, if you have somebody who has gone through this experience and they are saying, well, I'm a cholera patient and this has happened to me, and I want this to, this almost took my life, I think the community will resonate with them better, and the stories turn out better also. Over to you.
Yeah, thank you, Esther. Yeah, indeed, always having a civil society voice to balance off policymakers and researchers is always a good thing, especially for journalists. I'll have Joyce first, and then I'll get to Catherine. Joyce has had her hand up for a long time. Joyce, would you like to unmute yourself?
Hello, everyone. I hope you can hear me. Can you hear me?
Yes, we can. Yes, we
Yeah,
can.
sorry, I won't share my video. I'm nursing my baby here. Yeah, I wanted to add on what the panelists are saying. It is the role of we, the journalists, to come out first and bring out the rightful information, the evidence-based information to the communities so that we can convince them on what is taking place and how they have to respond. For example, there was a case with COVID-19 lockdown here in Uganda. Communities had adopted the system of using herbal medicine as a remedy to avoid COVID-19 and whatsoever, and it had greatly affected people's lives negatively because some people even lost lives, the steaming, the herbal intakes and whatsoever. So it is the role of the journalists to come out, not to surrender, not giving up, but to make sure that we give them the right full information, however much they are using the other herbs and they are convinced about the use of the herbs, but to bring out the other side of the scientific information about the effects, negative effects, and what they should use to save their lives. Thank you.
Thank you, Catherine, for that. Catherine, have you put your hand down? Can unmute.
Good afternoon. My name is Catherine from Zimbabwe. I'm with the Health Communicators Forum. Anna is our chair. We are also battling the cholera pandemic in Zimbabwe right now. The way I'd like to put the cholera message out is to our authorities is this is something that is preventable. We need clean water, we need sanitation, and we need hygiene. We cannot be talking of a vaccine. To bring a vaccine, it will cost the country. I'm not sure of the amount that was used, just a rough figure to say we will use 3 million to bring the vaccines. That 3 million could have gone to better use if we had sanitation, if we had clean water, boreholes in areas that don't have water. So as long as we have open defecation, as long as people don't have clean water, then vaccine is a stopgap measure because it's effective for 3 years, if I'm correct. So we can't be bringing something that is temporary, yet cholera can be prevented if we follow the basic structural order of water, clean water, sanitation, and hygiene. It's so sad to get into a community where there are no proper ablution facilities. You know that cholera becomes endemic to that area. Right now, 63 districts out of a total of 65 districts in Zimbabwe have cholera. It's no longer endemic to four districts. It's now national. That is how bad it is. It shows that we are not taking WASH seriously. Thank you.
Thanks very much, Catherine. And yeah, I think it speaks to something that Esther said, that sometimes there are some journalists that become advocates because we see things and we know that they could be better. And yeah, we become advocates. But I wonder really, is that a good thing? Is it possible to be both an advocate and a journalist? How does that work, Esther? Sorry, Esther, did you hear me?
I think Esther's
I think
frozen.
Esther's gone off. Go ahead, Anna.
Yeah, my favorite topic, Anna, the journalist and advocate. it's a tightrope. It's a tightrope. But I think there are times when I mean, all of us in every situation we have our feelings, we have our things that we've had. So like for example, you can't talk, if you talk about COVID, some of us have had COVID, some of us have lost people, to COVID. We are affected in everything as a journalist. You're either affected by it directly or someone in your community, or you live in that community. So I think in a way, all of us are advocates. We just, don't use those words. We don't maybe come out and say, oh, I'm an advocate. And so it's, I think the more I grow, the more I see this, the fact that, we are all advocates in one way or the other. And thank you so much, Michelle. I saw your comment. It's workable. Yeah. You can decide to look, we are taught to look at things both ways, but somehow, somewhere, the evidence that is there, what's happening in your communities, so you can speak out. Like, you really, how do you expect someone who's jumping over, raw sewage that's flowing in the street to not write about it when you live in that street? You become an advocate. It's who we are, I think, as people. But Esther is a better answer.
Yeah, Esther is a better answer.
No, Anna, you have a better answer. Anna, you have a better answer. I lost out on a bit of that.
Sorry, I was saying that how do you walk the line between being an advocate and a journalist?
Yeah, I think it's a thin line, and the people who do it know how to do it very well. And like Anna has explained very very explicitly, you can wear different hats on different occasions and try and be as ethical as possible. And yeah, we are living in these communities, like she says, and we see things happening around us, and sometimes you can't help yourself but to speak out and say, we need this to happen. We badly need this to happen. You detach yourself from that when you're writing a story, and that's the reason that we have advocates coming in and patient experts coming in. So even if you're feeling it within your head and you're feeling it within your community, you have a duty to ask this expert to say what they have to say and report on it ethically. But in your head, you're living it.
Oh yeah, it makes perfect sense. I think when it boils down, I think every journalist is an advocate at some point, because there are things that are important, and that's why we search for truth. That's why we search for explanations. That's why we do the work we do. So there is a lot of advocacy in what journalists do. And it brings me to another point that you raised, Anna, about being empathetic, and the line between being empathetic and becoming an advocate. Stepping away from becoming too engaged in the issues, so that you keep a level head. How do the cafes help you do that? You have civil society with you, you've got the researchers with you. Both are telling you maybe not the same thing, but you need to make a call. How does that work with the cafes?
So usually, because of the three voices, there's very rarely a situation where it's completely opposite, and what I like about, and which I'm also learning about writing, the journalists that we have, you can actually tell those that have been in the science cafes for a long time, they've mastered this art very well. Of, you can hear or feel the empathy in the story, but you can tell that this person is not judging either way. Like, one of the hardest stories for science journalists to write is people who, like this other cafe that we had, completely dismiss science. Like, they'll tell you, we don't believe in this. Our members of our church, they don't get HIV, they don't get any of these diseases because they are protected by the Holy Spirit. And we have had people who've had to write such stories. It's completely opposite of what the researcher is saying. Listen, measles is happening. People, need to get vaccinated. And they'll tell you, our children don't get measles. They just never. even if they go out in the world, they are protected by the Holy Spirit. And it's a skill, but it takes time again to cultivate, but eventually it does happen. But the thing of having 3 people in the cafes, I think, has been really helpful, because you rarely do you find people that are completely opposite all the time. There are some people who are going to say someone who's going to straddle the line and say, yes, we understand that they are religious objectors, but we do need to move, because some of these children are now coming in communities, and we've had this measles outbreak, and we've had deaths in these churches. So we need to do something about it. Yeah.
Yeah, that's very interesting, Anna, the point you raised. Esther, do you have that in your cafes where you have not troublesome audiences, but you have journalists that are not in sync with what you and the researchers are saying? Almost, I think this happened a lot during COVID over vaccinations. We had some journalists that absolutely refused to get vaccinated. And these were these were health reporters. And it was I don't know if we've actually managed to change their minds, but we do have sometimes people with contrary views. How do you manage that in your cafes?
I think journalists are part of the bigger community, and building trust for somebody to get something as small as a vaccine or as big as a vaccine is gradual. So as much as some of the journalists were attending cafes, I remember we had a random call and asked, how many of you have gotten vaccines? And you would feel it. But it's not only even journalists. There's a study that was done here in Uganda, and you'd see so many scientists who may seem to actually understand the science, who did not pick up the vaccines. So I think building trust is gradual. For somebody to really understand this and say, I am going to pick up a vaccine, I am going to pick up this information and take it and do what I'm supposed to do, is gradual. And science cafes offer that because it's a continuous thing you're doing. The cafes we hold, we have a lot of media people who go away. I forget the right word, but the turnaround time for people to stay in the media in Uganda is not so long. So it's not like all the people who are attending our cafes are the people we started with a decade ago. We have newcomers, we have so it wouldn't surprise me that some of them have just gotten into science writing. It wouldn't surprise me that some of them are not believing what we are saying, but we also know that they will, with time, try to understand these things. And we have a very wonderful program in all the cafes that we hold in every country. We have mentorship programs that you can identify these people and say, well, we have this person who may not be believing this science, and can she be helped? Will she be understanding the importance of this? Maybe she can look up to somebody who has done this for many years and be mentored and be told to understand how evidence-based information works. So it's not like everybody who comes will straight away embrace the information you're giving them and will probably pick up the vaccine when you say, oh, vaccines work, or will probably believe climate change is for real. It is a sustainable way of communicating, and for everybody, it's a sustainable way of getting this information in your ears and acting upon it.
Thanks, Esther. And we're coming up the top of the hour, I think more than an hour. And it's been a very lively discussion. I've learned so much from the both of you. I think you have amazing cafes and you're doing amazing work with civil society as well, and being advocates. And with that, I'd like to thank you both, and I'll hand it over to Jim.
Thank you so much, Zarina, Anna, Esther, and Kay, for a really great conversation. We are at the top of the hour, but I would love a quick final answer from each of you, all three of you actually, Zarina, Anna, and Esther. If you could send our audience away with one morsel, one really important thing to remember from this work, a lesson they can take back to their efforts and however they are and however they're working, what would that be? So I'll go around the list. I'll start alphabetically with Anna. A morsel.
I thought we were going to start with that for Zarina, but I'm going to say that time and patience and investment, because it's, as a researcher, you need to take that time to work with journalists, because it's not easy to, I mean, you have probably spent years and years learning the things that you know, but now you want to break it down to someone, probably in a cafe that's 2 hours. So you need, it's not something that you can just do. You need to take the skill and the patience to do that as a researcher. And the advocates as well. I know sometimes journalists are not interested in your story, but it does also, because I've seen some advocates that are here in this group, do take time to cultivate those relations with journalists, because they are an important ally. And for the journalists, take time for your craft. It is a craft, and it doesn't happen overnight. You don't get published in the Lancet like Esther overnight, but it does take time. So do invest in your craft. Those are the words that I would leave you. Yeah.
Those are delicious morsels. So smart. Thank you so much for sharing those, Anna. All right, going down the alphabet to Esther.
Thank you very much, fellow panelists, and thank you, Jim. I think the thing that I want people to take away here is, especially journalists and advocates and scientists, really everybody, we have a lot of communities that want to understand science, but science should be communicated easily, simply, and, sustainably over a period of time and continuously. And one of the things that I usually really want people to also do is to communicate it in the local languages. I know there is a fine line of, some science, how do you really do that? But I think with the science cafes, we have gotten to a level where the people we invite really, really try to communicate in our local languages, because then our audiences will understand these messages. There are bigger audiences beyond. Many people here do not speak English, and they would love to hear these messages, and they would want to be part of the conversations, and they are the communities. So I think if we have to improve, understand science, we have to put in an effort of doing that, explaining it simply, but also chiming in with the local languages so that we have bigger audiences and we make people understand, and we take our messages further than the small audiences we are thinking about, of people who are educated and speak English. Over to you. Thank you.
Thank you, Esther. And since we are literally going from A to Z, Zarina, you have the last morsel for our wonderful audience today.
Well, yeah, my takeaway is we're all advocates here. We're all advocates for truth. We're all advocates for justice. We're advocates for good public health. So I think we don't have to make any apologies for it. We can stick up for our communities in the best we know how, and that is by writing, and writing, messaging, and messaging until somebody hears us. So yeah, thanks everyone for a lovely discussion tonight.
Thank you, Zarina, for expert moderation. Thank you for all of your wisdom and sharing, Esther and Anna and Kay. Thank you to Manju and Angelo and the team at AVAC who work on these media cafes. And really importantly, thank you to everyone who showed up today. And thanks to everyone who registered and wasn't able to join us in real time. You'll be listening to this recording and taking lots of notes, I'm sure. There was so much here to digest and take forward with us. So with that, I'm going to officially close the call. Thank you so much. I hope to see you all February 15th. And before that, on our robust discussion list of the choice agenda, take good care, be safe, be healthy, and have fun. Ciao.
Thanks, Jim. Bye, everybody.
Bye. Bye, everyone.